On this year's ballot, Colorado voters will get to decide if they want to make psychedelic mushrooms legal. Joining me this morning to talk all about the shrooms and a potential study on the potential health benefits of magic mushrooms is Nine Health expert Dr. Payal Kohli. Thank you for coming in.
Good morning.
We've been talking about this for a couple minutes now, so tell us a little bit about this study.
Yeah, so this is a study, actually a really game-changing study if you think about it, because first it's studying the impact of smoking cessation, which we know that fewer than 1 out of 10 people who try to quit smoking actually successfully quit. So it's going to have a huge impact if it actually works. And second, Corey, it's the first time in 50 years that the federal government has funded a study of psychedelic substances for medicinal use. So I think it's kind of changing the paradigm of how we think about some of these substances that have been basically taboo in our society for so long.
What do you think the impacts of passing these could be?
You know, I think it could really open the floodgates for all the different uses for these types of substances. And, you know, if you think about kind of the history of how mushrooms came about, they've been around for 6,000 to 7,000 years. In fact, in some of the literature, there was all these mushroom worshiping ceremonies because people realized just the impact of the properties that they had. And here in the US in the 1930s and 40s, we started studying LSD. And then 60s and 70s, when, you know, the hippie generation came and they were excessively using them, they became a taboo. So I think this is a new message from our government saying that, yeah, the federal government is on board with studying these because they've had such valuable impacts on so many different conditions already.
I mean, this study specifically was about nicotine and smoking, but there have been a lot of studies about how it can be beneficial for anxiety, depression, PTSD, and so on and so forth.
Tons of studies, even things like schizophrenia and autism. And we're even looking at using it in younger adults, adolescents, even potentially children. And the nice thing about these substances, of course, they bind the serotonin receptor in the brain, but the onset of effect, it's dramatic. It comes on within 30 minutes. Its peak effect within about 60 minutes. And then within about a day, it's kind of gone from your body. So it's almost sort of like hitting a reset on whatever it is you need to hit a reset on. In the case of this particular study, it would be, you know, nicotine cravings. And they're randomizing people. So they're saying either you get, you know, the psilocybin, which is the active component of the mushrooms at 2 different doses, or you get vitamin B12. So we'll know very clearly whether or not this is having an impact.
Wow. But we were talking about how mushrooms can be deadly as well if they're not taken correctly.
Yes, and I'm so glad you brought that up because I know many people use them for recreational use, and I'm really apprehensive about that because, you know, in certain doses, they're okay in small doses, but when you start exceeding a certain dose, you can get something called serotonin syndrome, which can be life-threatening, and of course can cause, you know, acute effects, but can also probably cause long-term effects, and they're not FDA regulated, of course. So when you're getting something, you don't exactly know what you're putting inside your body and what the effects are in the short term and the long term. So I think medicinally, we're really looking at an opportunity here, but recreationally, I would caution people to be careful.
It's better under medical guidance.
100%.
For a doctor to tell you how to use that. Very interesting. Well, we'll see what happens when, you know, people cast their vote and see if it's passed.
There are states that have already decriminalized them, so it'd be very interesting.
Okay. Yeah. Dr. Kohli, thanks for coming in.